Philippines medical issues and doctors. Filipinos get sick like everyone else does. The Philippines itself is a crowded place, and probably the fact that there is less space between people means that people catch bugs regularly. If you have a Filipina sweetheart, you will have to deal with her getting sick sometimes. And every Australian man in an Australian Filipina relationship needs to learn a few peculiarities about Philippines medical issues and doctors. Okay. First one here, being OA, which is the local term for overacting. Now I will tell everyone who asks that your average Filipino is a survivor and a pretty capable lady. Usually a pretty lady too, but that's off track. If she needs to stand in queues all day, or take long bus trips, or work long hours, yes, she can do so. However, if she feels unwell, will she put on a brave face and say the Tagalog equivalent of "she'll be right"? Not likely. Not with her man especially. Now, she will moan and groan, she will cry easily, she will look like she's about to fall off the perch sometimes. Then she'll burp and say she feels better now. Now, don't apply this rule of thumb to each and every situation, of course. You may miss something serious, and I don't want you blaming poor old Jeff for it. So take note that Filipina ladies do love being fussed over by a loving and caring man, so I do suspect this may be a part of it as well. But do yourselves a favour and learn the difference between a bit of OA and a genuine need for medical attention. It can take you years to work this one out, let me tell you. Now, generic medicine and self-prescribing. This is a country where you can buy most medicines over the counter at the pharmacy with no prescription. No strong painkillers or sedatives, but things like antibiotics, most definitely. So people self-prescribe. Let me explain what's wrong with that. Now, generic medicine. What this means is cheap drugs with questionable quality, coming in from China mostly. So whilst it may be the right drug, it may be ineffective on the disease. As far as I can gather, you can reasonably rely on the larger pharmacy chains and need to avoid the generic medicine places. Relying on unqualified advice. Yeah, a bit of a problem all round with a whole lot of things in the Philippines. Now, relying on the neighbour telling you that amoxicillin will work, or taking what they took for their condition, which surely must be exactly the same as yours. If it's the wrong medicine, it simply won't do anything, obviously. And the danger with antibiotics is the build-up of drug-resistant bacteria out there. I'll explain that shortly in more detail. Another one, only taking until you feel better. That's a very common scenario. Go to the chemist, pharmacy in the Philippines, ask for a particular medicine, they will ask, how many do you want? I'm serious. In Australia, you get the box, and with antibiotics, you know that you need to finish the entire course whether you feel better or not. Here, you get as many as you can afford, or as few as you can afford, and then stop. And common with blood pressure, hypertension, or high blood, as it's called here. People take the medicine when they feel bad, and they stop taking it as soon as they feel better. That's very dangerous. Now, drug-resistant organisms. I mentioned with amoxicillin before. It's even available in some sari stores here, and it's the stock standard antibiotic that most Filipino grandmas and helpful neighbours will suggest. And there are plenty of cheap generics out there too, and people may only take 3 to 4 of them when they get sick. Now, drug resistance means, well, you go in there with your medicine and you wipe out some of the bacteria with a weak dose of a broad spectrum antibiotic like amoxicillin, and you wipe out half the population of that bacteria. Now, if you do that, which ones do you think will survive? Well, the stronger ones, obviously. And if you keep using the same drug time and time again, then some of the surviving bacteria, the tough guys that is, may manage to form genetic mutations which are totally unaffected by that drug. So, see what's happening there. Now, your doctor will know when an organism is showing resistance out there in the broader population and will prescribe something else which is more likely to wipe out the mutating tough guy bacteria. So in other words, minimum dosing with poor quality medicine just makes the bug stronger and harder to control. Very dangerous game for an amateur to play. Now the other one is avoidance of doctors. Now I suppose much of this comes from being short of money. That's reality. Remember, this is a country where there is no Medicare, no pharmaceutical benefit scheme like there is in Australia. Going to the doctors costs money. Proper medication costs money. Blood tests, ECGs, X-rays, etc. These all cost money. And proper medication costs money. Blood tests, sorry, I said that one already. They all cost money. So much of this would come from a history of not being able to afford proper treatment. So you will generally find the scenario is something like this. Okay, picture this. Oh, areiko masakit. And the sounds of suffering. You say, you better go to the doctor, and you will get, no, not the doctor, no, I'll be fine. Does that sound familiar, gentlemen? Certainly does to me. Now, most of us know that most medical conditions can be treated and managed when you get onto them quickly. Many conditions left untreated can deteriorate and sometimes cause death, and this does happen in the Philippines all the time. Now, high blood pressure, high blood, often undiagnosed and often unmedicated. As I said, people take the medicine when they feel bad. As soon as they feel better, they stop taking it. Now, diets high in salt and high in fat play a part, and untreated, this can lead to strokes, heart attacks, and kidney disease. Diabetes, very common here. Eating absurdly large quantities of rice, too much sugar, fried foods, sorted junk foods. Now, untreated, it leads to amputations, and blindness, and plenty of other nasties. Breast cancer and cervical cancer, you ask your lady if she's ever had a pap smear, or if she knows how to check her boobs properly for lumps. I bet the answer is no. Ask her right now, you may be in for a shock. Now, basically, you put the hard yards in, meeting a wonderful lady, developing a precious relationship, and struggling through the visa minefield so you can lead a happy life. Now, you make sure you take care of her, and make sure she takes care of herself, so you can enjoy each other for a very long time. Thank you. This video was brought to you by Down Under Visa, who specialise in visas for Australian Filipina couples. Please visit our website and complete a free visa assessment form. And please watch some of our other videos. Thank you.